So good evening to all of you. Good evening to all of you. Okay, and let us start with this peritoneum. Starting with peritoneum. So I am Dr. Pradeep Pawar, Professor of Anatomy. I've got a vast experience of teaching the undergraduate and postgraduate students, as well as the PG students. Okay. Now we start with the peritoneum. Before this, just see this muscles and try to identify this muscle, students. If you can tell me what is this muscle. So this is the posterior abdominal wall. So hello to all of you. Starting with this peritoneum, a difficult topic. Just try to correlate, understand all these things. I'll start. What is this muscle? Come on, be interactive so it is easy to teach and understand. The first muscle, this is the posterior abdominal wall. The first muscle here, that's the psoas major. Psoas major, and occasionally we get this muscle here. Occasional. What is that? Psoas minor. Psoas minor. This is a quadrangular muscle, students. This is a quadrangular muscle of the lumbar region. What is that? Yes, Mednir. Hello. So that's a quadrangular muscle of the lumbar region, and that's the quadratus lumborum. Quadratus lumborum. And the third muscle here, this is the transverse abdominis. Transverse abdominis. So students, psoas major, the quadratus lumborum, and the transverse abdominis. These three muscles are going to form what? The posterior abdominal wall. Posterior abdominal wall. And if you can quickly tell me what is this? This is a thickening of the psoas fascia. You can see this structure here. This is what we call as, anyone, what is this known as? This is what we call as the medial arcuate ligament. That's the medial arcuate ligament, and that's a thickening of the psoas fascia. Thickening of psoas fascia. And what is this ligament? This is the lateral arcuate ligament. Lateral arcuate ligament, and that's a thickening of anterior layer of thoracolumbar fascia. Thickening of the anterior layer of the thoracolumbar fascia. So that's the medial arcuate ligament, and that's the lateral arcuate ligament. Clear, students? So medial arcuate ligament is a thickening of psoas fascia. The lateral arcuate ligament is a thickening of the thoracolumbar fascia, anterior layer of thoracolumbar fascia. Why is all this important? Because this all gives origin to the diaphragm. Diaphragm. So if you see the posterior origin of diaphragm or the vertebral origin of diaphragm, diaphragm has got origin from the bodies of the lumbar vertebrae. What do you call this as? The crus of the diaphragm. Crus. So that's the right crus which arises from the bodies of L1, L2, L3 vertebrae. And that's the left crus arising from the bodies of L1 and L2 vertebrae. So the right and the left crus, the medial arcuate ligament and the lateral arcuate ligament, all this is going to give origin to the diaphragm. Okay, so this is the vertebral origin of diaphragm. Fine. So we place an organ here, and what does this organ become? The kidneys, right? So all this becomes the posterior relation of the kidneys. Students, what I'll do is I'll just give you an overall orientation, and then we will start with this peritoneum, topic peritoneum. I'll just give you an overall orientation first, just try to understand. I'll start with the posterior relation of the kidneys. पहले ये relation देख लो. Once you're clear with this relations, once you're clear with the orientations of the organs, you will understand the reflections of peritoneum very well. So this, I'm telling you, are the posterior relations of the kidneys. Yeah. The first muscle on the medial side, what is this going to be? Psoas major. Psoas major. The second muscle, that's the quadratus lumborum. And the third muscle, that's the transverse abdominis. So psoas major, quadratus lumborum, transverse abdominis, these three muscles are going to form what? The same three muscles which forms the posterior abdominal wall. Something here like this and something here like this. What is this, students? That's a medial arcuate ligament, and that's the lateral arcuate ligament. Medial and lateral. There's a nerve here, there's a nerve here, and there's a nerve here. Anyone, what is this nerve? Can you identify this nerve? The nerve below, coming below the lateral arcuate ligament. Anyone? That's a subcostal nerve. Subcostal. That's the iliohypogastric and that's the ilioinguinal. So subcostal, iliohypogastric, ilioinguinal nerve. So these are the three nerves. And tell me students, now which kidney is lower? Which kidney is at a lower level? The right, because of the liver. So the right kidney would be related only to the last rib. Which number is that? 12. Whereas the left kidney would be related to two ribs. That's the 11th and the 12th ribs. Okay. So this becomes the posterior relations of the kidney. बस एक ही difference है right and left kidney में. Right is related to 11th and 12th rib and the left is related only to the 12th rib. The right is related only to the 12th rib, sorry, and the left is related to the 11th and the 12th ribs. Okay. Clear students? So this becomes the posterior relations of the kidneys here. The psoas major, the quadratus lumborum, the transverse abdominis, the medial arcuate ligament, the lateral arcuate ligament, the subcostal, iliohypogastric and ilioinguinal nerves. Okay, now understand the anterior relations of the kidneys. Look at this now. The same slide it is. So what is this muscle? What is this muscle, students? That's the psoas major. That's the quadratus lumborum. That's the transverse abdominis. The medial arcuate ligament. The lateral arcuate ligament. Subcostal, iliohypogastric, ilioinguinal nerves. So you place an organ here. That's the right. That's a kidney. So this becomes the posterior relations of the kidney. Clear, students? Now understand the anterior relations of the kidneys. Both the kidneys, I tell you simultaneously. एक बार ये clear होता है, you'll understand the peritoneal reflections very well. Okay. Now starting with anterior relations of both the kidneys simultaneously. If you know, you answer this, huh, bachcho? Now I'll start. Tell me, both the kidneys would be related to what? What are these? These are the suprarenal glands. So both the kidneys would anteriorly be related to the suprarenal gland. What is this? Anyone? The right kidney is anteriorly related to what? What is that? Come on students. Bolo, answer. The right kidney would anteriorly be related to which part? Which part of duodenum? The second part of duodenum. The second part of duodenum. Excellent. Very good. If that's the second part of duodenum, what is this going to be? The pancreas. So the left kidney would anteriorly be related to the pancreas and that's the spleen here. Pancreas and spleen. Now tell me, what is this artery here which is related on the superior border of the body of the pancreas? That's the splenic artery. Splenic artery, right? There's a big organ on this side. What would this organ be? That's the liver here. Liver. Now there's someone who's ascending up. You can answer this. What's this ascending up? That's the ascending colon. And what is this bend known as? Students, what is this bend? Ye liver hai. So what is this? The hepatic flexure of the colon. That's the transverse colon. I'm not drawing the transverse colon. That's the splenic flexure and that's the descending colon. Descending colon. Okay. And plus something else also you get here. You get the, sorry. Oh my God, that's gone. I'm so sorry. Yeah, no, the problem with this is, just one moment, I'll just draw it again for you. एक बार वापस draw करता हूँ, है ना? थोड़ा भी, if it goes, the screen is gone. Okay, so these are the suprarenal glands. Now quickly tell me, the right kidney is anteriorly related. Just one moment. One moment. Okay. I'll draw with the same color now. Look. Okay, so that's the right kidney, that's the left kidney. Quickly, once again, tell me, both the kidneys are related to the suprarenal gland. The right kidney is anteriorly related to the second part of the duodenum. If that's the second part of the duodenum, that's the pancreas and that's the spleen. अगर ये pancreas and spleen है, what is this artery then? What is this artery? The splenic artery. What is this organ? This big organ on the right side, that's the liver here. Someone is ascending here, that's the ascending colon. And what is this bend now? That's the hepatic flexure. That's the transverse colon here, that's the splenic flexure, and that's the descending colon. Okay, and something else we get here, these are the coils of small intestine. Now look students, the right kidney would anteriorly be related to, this is very important, you get MCQs on this and then you'll understand the peritoneum. So the right kidney would anteriorly be related to the right suprarenal gland, the liver, the second part of duodenum, the ascending colon, and the hepatic flexure of the colon, the small intestines. The left kidney would anteriorly be related to the left suprarenal, the splenic artery, the spleen, the pancreas, the splenic flexure, and the descending colon, and the small intestines. And students, if you place an organ here like this, look, if I place an organ here like this, what is this organ going to be? You can define the outline of this. So this is the stomach and this part is related to the stomach, and all this is going to form what for the stomach? The stomach bed. So all this would be forming the posterior relations of the stomach, and that is going to form the stomach bed. So once again students, look at this. What is the anterior relations of the right kidney? One, the right suprarenal gland, the liver, the second part of the duodenum, the ascending colon, and the hepatic flexure of colon, and the small intestines. The left kidney would anteriorly be related to the left suprarenal, the stomach, the splenic artery, spleen, pancreas, the splenic flexure, and the descending colon, and the small intestines. Clear to all of you? And now if I place an organ on this, that organ becomes the stomach, and all this would be forming the posterior relations of the stomach. Something else also forms the posterior relation. Look, the posterior relations of the stomach would be formed by one is the left suprarenal gland, the left kidney, the spleen, the splenic artery, the transverse colon, the pancreas, right? The pancreas, the transverse colon, and what is this? Anyone can identify what is this that I've drawn? Anyone? What is that structure which I've drawn, which forms the posterior relations of the stomach? Yes, anyone? What is that? Stomach bed. Stomach bed में आता ही है. What is this? Anyone? Yes, Medner. What is that? The rest of you also answer. This is the left crus of the diaphragm. Left crus है ये बच्चों. Left crus. So that's the left crus of the diaphragm. Stomach bed would be formed therefore by the left suprarenal, the left kidney, the spleen, the splenic artery, pancreas, transverse colon, the left crus of the diaphragm. Left crus. Okay. So now you tell me students, the moment we open the anterior abdominal wall, the moment we open the anterior abdominal wall, the first organ on the right side is going to be what? On the right side, liver. On the left side, the first organ seen would be the stomach. So on the right side, liver, on the left side, stomach. Now, we'll lift the stomach. Who's behind the stomach? What is this structure behind the stomach? That's the transverse colon. Look at that. That's the transverse colon. We lift the transverse colon. You lift the transverse colon, and who's behind the transverse colon? What is this structure? That is the pancreas. You understanding? मतलब सबसे anterior stomach. Behind the stomach, transverse colon. Behind the transverse colon, the pancreas. Okay. Now, what I'll do is I'll draw a sagittal section for you. A sagittal section. Just understand this. This is a very important slide. Have a look. Understand this now. That's the stomach here. Stomach. ये सबसे आगे है stomach. Behind the stomach is what, students? Transverse colon. And behind the transverse colon is what? Pancreas. You understanding? एक के पीछे, the one behind the other. Stomach, transverse colon, pancreas. Okay, I'll just put the name here: stomach, transverse colon, and pancreas. And who's this behind the pancreas, students? Who's this behind the pancreas? That's the posterior abdominal wall. That's the liver here. And this liver is what is this that I've drawn? Diaphragm. And the liver is fixed to the diaphragm. यहाँ पे fixed होता है. It is attached to the diaphragm. What do you call this as? The bare area of liver. That's the bare area of liver. Understanding? So that's the liver, that's the diaphragm. The liver is in contact with the diaphragm, and this is what we call as the bare area of liver. Stomach, transverse colon, pancreas, the posterior abdominal wall. Okay, I'm starting here. Just have a look. Understand this first. Here, students, we start from the liver. We start from the liver. We are coming down. We are coming down. Who are we? Who are we? Ye kaun hai? Who's this? From the liver we begin. We come to the stomach. This is the lesser omentum. Lesser omentum. The lesser omentum is going to split. ये split हो गया. देखो ऐसे it encloses the stomach. Students, it encloses the stomach. It goes down like this. What is this? The greater omentum. The greater omentum again turns and goes back like this. Gets an organ here. What's that? Transverse colon. Splits. Encloses the transverse colon. इसे क्या बोलते हो? This is what we call as the transverse mesocolon. Transverse mesocolon. So students, the stomach, the transverse colon, these organs are completely enclosed by the peritoneum, and such organs which are completely enclosed by the peritoneum are known as intraperitoneal organs. Intraperitoneal organs, and these organs move with respiration. They move with respiration. Okay, so these are the intraperitoneal organs. The peritoneum now comes behind and splits over the pancreas. So where's the pancreas gone? Students, the pancreas has gone behind the peritoneum. ऐसे organs को क्या बोलते हो? What do you call such organs as? Retroperitoneal organs. Retroperitoneal organs. I trace this layer of peritoneum. This layer goes on the posterior abdominal wall like this. It goes to the diaphragm here. It can't cross the liver, and now it gets reflected back to the liver. Okay, it will be getting reflected back to the liver like this. And look, students, what is this space behind the stomach? What is the space behind the stomach? Yahi hai lesser sac. We call this as the lesser sac. Fine. Now, we trace the second layer of peritoneum. The second layer of peritoneum goes on the posterior abdominal wall. Again, ye dekho kaun hai? This is the mesentery to the small intestines. The small intestines are enclosed within the peritoneum. We call this as the mesentery. The peritoneum now goes down, gives an inverted V-shaped mesentery. Inverted V. What is this for? The sigmoid colon. Sigmoid colon, and what do you call this as? The sigmoid mesocolon. This is what we call as sigmoid mesocolon. Now the peritoneum comes down into the pelvis. अब ये pelvis में आ गया. In the pelvis, it covers the rectum, covers the uterus, covers the bladder. So that's the rectum, that's the uterus, and that's the bladder. It is just going to cover the rectum, the uterus, the bladder, and such organs which are below the peritoneum. These organs are below the peritoneum. क्या बोलते हो? These are therefore known as the subperitoneal organs. Subperitoneal organs. Okay. Subperitoneal organs. Now the peritoneum goes to the anterior abdominal wall. Here goes to the umbilicus, and from the umbilicus it goes straight up to the diaphragm. Can't cross this, gets reflected back to the liver. So what is all this? This is the greater sac. That's the greater sac here. That's the lesser sac here. Okay, greater and lesser sac. And what is this? Foramen behind the lesser omentum, known as, this is what we call as the epiploic foramen. Epiploic foramen, or the foramen of Winslow. Foramen of Winslow. Are you all following this? समझ में आ रहा है? I'll just label this. If you want, you can draw this first. I'll just label this for you. Okay. That's sigmoid mesocolon. Greater omentum. Less omentum. Greater omentum, less omentum. A transverse mesocolon, right? That's a transverse mesocolon. that's a greater sac. Very good. And that's the lesser sac. Greater sac and lesser sac. Okay, we get two pouches here. क्या बोलते हो? What is the name of this pouch? Recto. Uterine pouch. Retroperitoneal pouch. Now, recto-uterine pouch is the pouch of Douglas. Yes. So, recto-uterine pouch is the pouch of Douglas, and rectovesical pouch. So, that's the slide. And that's the epiploic foramen. Epiploic foramen. I hope this is clear to all of you. Koi doubts hai isme? Any doubts? Okay, very good. I'll proceed. Yes, the rest of all of you, should I proceed? Now, so look here once again, from the liver the peritoneum begins, comes down, that's the lesser omentum, encloses the stomach, goes down, that's the great omentum. The great omentum turns and goes back, encloses the transverse colon, and this is the transverse mesocolon. अब ये जो stomach है, transverse colon है, these organs are completely covered by peritoneum. This is what we call as intraperitoneal organs. The peritoneum goes back and splits over the pancreas. One layer goes over the posterior abdominal wall to the diaphragm and gets reflected back to the liver. What is all this? Lesser sac. The second layer goes on the posterior abdominal wall, gives mesentery to the small intestines. It gives an inverted V-shaped mesentery for the sigmoid colon, that's sigmoid mesocolon. Enters the pelvis, covers the rectum, uterus, bladder, and now goes to the anterior abdominal wall and straight up. So that's a greater sac, that's a lesser sac. Okay, I'll show you this slide. One moment, have a look at this slide. Now, if I clear this, I will not get the slide again. Okay, so all of you are clear with this? Just put your thumbs up if you are clear and then proceed. Come on, students. Bolo, bolo, bolo. Are you clear, all of you? Okay, I'll just proceed then. Look at this slide now. This is the same slide that we've been talking about. Okay, I'll try to magnify this. देखता हूँ कितना magnify हो सकता है. Okay, that's nice. That's nice. Here we start. So now you tell me. Very good, students. What is this now? What is this? That's the stomach. Yes, that's the stomach. Here. What's that? Transverse colon. ये stomach होगा. ये transverse colon है. That's the pancreas. That's the pancreas. What are these? What are these? Students, what are these? Small intestines. And what is this peritoneum given to the small intestines? That's the mesentery. ये pancreas है. What is this organ below the pancreas? He's drawn a lumen here. तो ये क्या होगा? The duodenum. Below the pancreas is which part of the duodenum? Third part of the duodenum. So that's the pancreas. Below it is the third part of the duodenum. Okay, we'll start. That's the liver. From the liver we begin. What's that? Lesser omentum. The lesser omentum comes down, splits, encloses the stomach here. Now goes down. ये क्या होगा? Greater omentum. The greater omentum turns and goes up again. Splits, encloses the transverse colon. What is this now? That's the transverse mesocolon. Now goes here, splits over the pancreas. One layer goes over the pancreas to the posterior abdominal wall, goes to the diaphragm and gets reflected back to the liver. Now, it's a very small space, बहुत छोटा सा space होता है behind the liver. What is this known as? Lesser sac. ये है lesser sac. Now, trace the second layer. The second layer covers the duodenum, gives mesentery to the small intestines. Now, he has not drawn that inverted V-shaped mesentery. He's not drawn that. What is that for? Sigmoid colon. The peritoneum now comes down into the pelvis, covers the rectum, covers the bladder. What is this pouch, students? You're male. So, what is this pouch? This is the rectovesical pouch. So, that's the rectovesical pouch. The peritoneum covers the bladder, goes to the anterior abdominal wall, to the umbilicus, and goes up straight to the diaphragm and gets reflected back to the liver here. What is all this now? That's the greater sac. What is here? Lesser sac. Understand? And behind, this is the lesser omentum, and behind this is going to be the epiploic foramen. Perfect, students, perfect hai? Okay. So now you tell me, look, now students tell me, the moment we open the anterior abdominal wall, ठीक है, जैसे आपने anterior abdominal wall को open किया, what is the cavity that we are looking into? Can you tell me what is this? What is this entire cavity that we are looking into? The moment we open the anterior abdominal wall, ये क्या देख रहे हो? What is this space here between the anterior abdominal wall and the stomach? What is this space? ये है greater sac. ये जो देख रहे हो, the thing which you are looking at is nothing but the greater sac. Are you following this, students? So anterior abdominal wall and stomach के बीच में, between the anterior abdominal wall and the stomach, the space is the greater sac, And look, this entire area is the greater sac, and you can see this foramen here, students, look at this foramen, and that is the epiploic foramen. ये होगा epiploic foramen. Yo, the arrows inside the epiploic foramen, and now if we go through this epiploic foramen, we are behind the stomach, we are right inside the lesser sac. We are now inside the lesser sac. Is this clear to all of you? So that's the greater sac. इसके पीछे होगा lesser sac, and that's the epiploic foramen. Now students, if you lift the greater omentum, who's behind the greater omentum? The small intestines. And who's behind the stomach? Stomach के पीछे क्या होगा? The transverse colon. So now I'm lifting this greater omentum. The moment I lift the greater omentum, इसके पीछे कौन होगा? Who will be behind this small intestines? And the moment I lift the stomach, who's behind the stomach? The transverse colon. Just have a look at this. Here we are. So we've lifted the greater omentum. What's this now? Small intestines. And behind the stomach, who's that? Transverse colon. Yep, that's transverse colon. Now students, you can lift all the small intestines. ये जितने भी small intestines हैं, that's okay, no problem. All the small intestines can be taken outside the abdominal cavity. We can take all the small intestines outside the abdominal cavity. Now what do we get? We get the attachment of small intestines to the posterior abdominal wall. We get the attachment of peritoneum of small intestines to the posterior abdominal wall. Now look what I'm doing. I'm lifting the small intestines. I'm taking the small intestines outside the abdomen. Now see, what do we find here? Look, what is this? What is this line that you're seeing? You can see this line. And this line is the attachment of the peritoneum of small intestines. What is the peritoneum covering the small intestines? Known as the mesentery. So this is the attachment of mesentery of the small intestines. Are you following? Matlab, see students, the peritoneum is covering the posterior abdominal wall like this. Okay, the peritoneum is covering the posterior abdominal wall along this line, the peritoneum gets reflected. ये peritoneum आगे आ जाएगा. It will come in front. It will enclose the small intestines. It will enclose the small intestines. It will again come back, and gets attached to the second line, this line. And now the peritoneum will go down. The peritoneum will now go down. ये जो line है ना, this line is known as the root of mesentery. The root of mesentery. Are you following? Students, थोड़ा सा difficult है, slightly difficult. Look, the peritoneum is covering the posterior abdominal wall. Just look at me. The peritoneum is covering the posterior abdominal wall along a line drawn from the DJ flexure. What is DJ flexure? The duodenojejunal flexure. From the duodenojejunal flexure, we draw a straight line. We draw a line. It goes oblique to the right sacroiliac joint. So from the DJ flexure, which is on the left side, to the sacroiliac joint on the right side, ये जो line होगा, this line is known as the root of mesentery. Okay, I'll be telling you what is this root of mesentery and what structures it crosses and all. That's very important. So that's the root of mesentery. Okay students, now ये सब organs आप देख रहे हो, all these organs that you're looking at, what are these organs? These are the retroperitoneal organs. Extremely important for you. So which are the retroperitoneal organs? Just have a look. 1. is the kidney. First is the kidney. Second is the suprarenal gland. Kidneys, suprarenal glands, the duodenum, the pancreas, the ascending colon, the descending colon. Transverse colon is not retroperitoneal, bachcho. Transverse colon is enclosed by the peritoneum. And what is the peritoneum covering the transverse colon? Known as the transverse mesocolon, right? So transverse colon is intraperitoneal. Don't forget that. So who's retroperitoneal, students? The ascending and descending, yeah, they are retroperitoneal. Okay. Now who's this? Aorta. What's this? IVC. And what's this? Ye kaun hai, bol sakte ho? I just started this for you. What is this structure? Anyone? What is this structure? Bolo, students, what is that structure? Anyone? What is that structure? Psoas. Very good, Faizan. That's psoas major. And you know, there's a structure which is lying on the psoas major. Kaun hoga ye? There's a rounded tubular structure lying on the psoas major. Any idea what is that structure which lies on the psoas major? Huh? A tubular structure. Bolo. Kaun hai? What is that structure lying on the psoas major? A tubular structure. Ureter. Very good. Ureter. There's a nerve also lying on the psoas major. Bol sakte ho, which is the nerve lying on the psoas major, students? Nerve lying on the psoas major is, anyone? The genitofemoral nerve. Okay. So I'll just make a list of retroperitoneal organs. A very important thing. Retroperitoneal organs. Okay. So which are the retroperitoneal organs? I'll just write this down for you. The kidney, the suprarenal glands, duodenum, except a small area of the first and the fourth parts. What is the meaning of this? This is what is you have to understand. So the entire duodenum is retroperitoneal. Students, the entire duodenum है ना peritoneum के पीछे, it's retroperitoneal except a small area of the first part. Why? Look, ये stomach है, that's the stomach. And who's this now? That's the duodenum. That's the first part of the duodenum. Now students, tell me, who's this enclosing the stomach here? What's that? Lesser omentum. And what's this? Greater omentum. So when this lesser and greater omentum are going to enclose the stomach, they also enclose a small area of the first part of duodenum. So first part of the duodenum ka length kitna hota? What is the length? 5 centimeters, right? So the first part of the duodenum is 5 centimeters long, out of which 2.5 centimeters are intraperitoneal. Following this, 2.5 centimeters are intraperitoneal. Similarly, after the duodenum, what do we have? After the duodenum, jejunum. And the jejunum is covered by what? The mesentery. The jejunum is covered by mesentery. And jab ye mesentery is going to cover the jejunum, students, a small area of the fourth part of the duodenum is also enclosed within the peritoneum. And that is how the fourth part of the duodenum partially is intraperitoneal. Understanding? So first part and fourth part, half are intraperitoneal. Clear, students? So the entire duodenum is retroperitoneal except a small area of the first and the fourth parts. Next is the pancreas. Next is the ascending colon and descending colon. Ascending and descending colon, aorta, IVC, ureters. Aorta, IVC and ureters. So this is the retroperitoneal organ. Any doubts? किसी को कुछ doubts है तो बोलो. Hello, Priyanshu, hello. Okay. Clear to all of you? So these are the retroperitoneal organs. I'll clear this up. Now understand this. What is the root of mesentery and what is the extent of the root of mesentery and what are the structures crossed by the root of mesentery? Another extremely important MCQ. Extremely important MCQ. So what is the root of mesentery? Just have a look at this slide. Okay, so that's the root of mesentery. Have a look. So root of mesentery extends from where? It extends from the DJ flexure. That's a DJ flexure. It goes to the right sacroiliac joint. From the DJ flexure, it goes to the right sacroiliac joint. Now, what are the structure which is crossed by the root of mesentery? 1. Who's this? Who's this? This is the third part of the duodenum. Third part of the duodenum. Yeah, students, I had told you duodenum के anterior relations. Third part of the duodenum के anterior relations क्या थे? The root of mesentery and this vessels. What were these vessels? The superior mesenteric vessels. These were the anterior relations of the third part of the duodenum. So root of mesentery would be crossing what? The third part of the duodenum, the aorta, the IVC, the right psoas major and the right ureter. The right ureter. So right ureter ka anterior relation, students. Right ureter ka anterior relation is going to be what? The root of mesentery. Root of mesentery. Are you clear? Following this, all of you? So this becomes the root of mesentery and these are the structures crossed by the root. Another very important MCQ. Okay, very good, very good. I'll just write this down for you. Yes, अब जो important है, I'm writing, students. Root of mesentery. Just write this down. Root of mesentery. Root of mesentery extends from DJ flexure, the duodenojejunal flexure to the right sacroiliac joint. Extends from the DJ flexure to the right sacroiliac joint. Structures crossed by the root. Structures crossed by the root. Third part of duodenum. Third part of duodenum. Aorta, IVC, right psoas major, right ureter. That's it. So structures crossed by the root of mesentery are the third part of duodenum, the aorta, the IVC, the right psoas major and the right ureter. Fine, perfect. So that's about the root of mesentery, the retroperitoneal organs, I've told you the posterior relations of the kidneys, then we came to the anterior relation of the kidneys, then we drew a diagram showing the reflections of peritoneum. Okay, then we discussed what was greater sac, what is lesser sac, and now how do you enter from the greater sac to the lesser sac? Yes, that is now what we are going to discuss, and this is the epiploic foramen. Epiploic foramen. So just understand this epiploic foramen, students. Another extremely important thing for you, the epiploic foramen. So अगर आपको greater sac से from the greater sac, if you have to go back into the lesser sac which is behind the stomach, there's a foramen here and that is the epiploic foramen. Here. So what are the, yes, foramen of Winslow. It is also known as the adductus to the lesser sac. Adductus to the lesser sac. And what are the boundaries of this epiploic foramen? Here, have a look. Anteriorly, what's this, students? Bacho, what is this? the lesser omentum. So anteriorly is the lesser omentum containing one. What is present in the lesser omentum? Anyone? So anteriorly is the lesser omentum containing, very good, lesser omentum containing hepatic artery, portal vein and the bile duct. So anteriorly is the lesser omentum containing hepatic artery, portal vein, bile duct. Who's behind? Posteriorly kya hoga? Just have a look. This is the epiploic foramen, right? That's the epiploic foramen. So who's anterior? The three structures: hepatic artery, portal vein, bile duct. Who's immediate posterior? Immediate posterior देखिए कौन है? IVC. Then is the right suprarenal gland. The right suprarenal gland and the body of T12 vertebrae. Okay, so posterior relation of the epiploic foramen would be IVC, the right suprarenal gland and the body of T12 vertebrae. Who's the superior relation? Superiorly is the liver, the caudate lobe of liver. Caudate lobe of liver. What is caudate process? I'll tell you later. And inferiorly is the first part of duodenum. So extremely important. I'll just mention this for you. The boundaries of epiploic foramen. Have a look. Epiploic foramen. Boundaries of epiploic foramen. Anteriorly is the lesser omentum containing hepatic artery, portal vein, bile duct. Okay, hepatic artery, portal vein, bile duct. Posteriorly, IVC, right suprarenal gland, body of T12 vertebrae. Superiorly, caudate lobe of liver. Superiorly is the caudate lobe of liver and inferiorly is the first part of duodenum. Very good. Perfect, students. Clear? Now, before I proceed to the next topic, I'll just brief you about our platform. Now, we have got many new courses which are coming up, students. So have a look at this platform. Ye clear hai na? Epiploic foramen? Okay. Now just have a look. Look at this slide. I'll show you this slide. Let me just finish this. Now we've got this plus subscription, students, in which you've got daily live classes, live quizzes, learning from the top educators. You can study on the device of your choice and access to over 25,000 plus questions from the bank. And now we are coming up with printed notes for our 12 months and plus subscription students. Okay. Now we have got an iconic subscription wherein we have got the best of Unacademy and the pre-platter. Now we're starting with this NEET PG compact on 10th of October, 11 AM, around 45 questions, 60 minutes. You have to answer 45 questions in 16 minutes on 10th of October, 11 AM. Remember the date, students. NEET PG compact, and a lot of scholarships are to be given by Unacademy. Okay. Now the iconic prizes. Iconic is the Unacademy and pre-platter. The iconic prizes will be soon rising from 1st of October. You can avail this benefit before the price hike. Refer your friends also. Raise a hand technique, in which there's a small icon in the app. If you press this icon, you can directly talk to the educator. Now, special class features you have: live interactive class, poll for the learners, raise a hand technique, never miss a class with proper notifications being given, lecture notes, and anytime, anywhere you can get your doubts cleared during the class. A highly effective and curated question bank with some 25,000 plus questions has been prepared with detailed explanatory answers, especially for you students. Now, these are our star learners who have got very good ranks in the recent exams, and we are proud of them. Now, we're starting with some new batches, students. Just to highlight, we are starting with Target NEET PG 2022 from 29th of September. We're starting with Mission INICET 2021 batch from 29th of September. We are also starting with Focus FMG batch and Clinical Examinations and Procedure batch from 29th of September. Now, boost your medical preparation, students. With 2 years, 24 months, you get 4 months free, and with 12 months, you get 2 months free subscription. Okay, download the Unacademy app. Download the Unacademy app. Okay, just have a look at this slide. I'll tell you this. Chalo, bolo. What is this? हाँ, मैं बोलता हूँ ना फैजान, relation है ना, relation बोलता हूँ of these three structures है ना, in the lesomentum. I'll tell you, बच्चा, I'll tell you. Okay, just have a look at this. Now tell me, what is this space? Students, ये देखो, what is this space? That's the lesser sac, right? That's the lesser sac. The space behind the stomach, that's the lesser sac. And what is all this? I'll just put a different color for you. What is all this space? What is all this around the liver here and stomach and the spleen? What is all this? That's the greater sac. And you can see here, that's the foramen here, that's the epiploic foramen. Epiploic foramen होता है यहाँ पे. That's the epiploic foramen. Okay. So that's the lesser sac, through which from the epiploic foramen, from the greater sac, you pass through the epiploic foramen into the lesser sac. Tell me one thing, spleen projects into which part of the peritoneal cavity? Students, look at the slide, you can quickly answer this. Spleen projects into which part of the peritoneal cavity? Anyone? Excellent, very good. It projects into the greater sac. ये देखिए. The spleen projects into the greater sac. And what is the posterior what is the anterior boundary of lesser sac formed by? Yes, बोलिए students, what is the anterior limit of the lesser sac? मतलब anterior boundary of the lesser sac is formed by what? Here. Who's that? That's the stomach, है ना? So anterior boundary of the lesser sac would be formed by the stomach. The posterior boundary of the lesser sac would be formed by the structures forming the stomach bed. Structures forming the stomach bed, they are going to form the posterior limit or the posterior relations of the lesser sac. Structures forming the stomach bed. And to the left side, what is this and what is this? If you can tell me, what are these two boundaries? Who's this? You can see the pointer now, students. What is this and what is this? Anyone? On the left side, what is this and what is this? ये लेफ्ट है, लीवर राइट पे है. सो व्हाट इज दिस? स्टमक है, ये स्टमक. हाँ, एक्सलेंट, वेरी गुड. ये स्टमक है, ये स्प्लीन है. सो व्हाट इज दिस लिगामेंट बच्चों? दैट्स द गैस्ट्रोस्प्लेनिक लिगामेंट. करेक्ट, गैस्ट्रोस्प्लेनिक. एंड फ्रॉम द स्प्लीन टू द किडनी, व्हाट इज दैट स्टूडेंट्स? द लाइनोरेनल लिगामेंट. लाइनोरेनल. सो द गैस्ट्रोस्प्लेनिक एंड द लाइनोरेनल लिगामेंट्स आर फॉर्मिंग द बाउंड्रीज ऑफ लेसर सैक ऑन द लेफ्ट साइड. समझ में आ रहे ना? The boundaries on the left side would be formed by the gastrosplenic and the lienorenal ligament. On the right side, it is open with the epiploic foramen. The lesser sac is continuous with the epiploic foramen and the greater sac. Yes, like that. Yes. Fine. Faizan, what are you asking? Structures within the lesser omentum, है ना? Structures within the lesser omentum. ये slide देख लो. This is the slide. And fine, that's a slide. One moment. Sure. Structures within the lesser omentum. Structures within the lesser omentum. I'll just write this down for you. Structures within the lesser omentum. The most posterior is what? The most posterior is the portal vein. Portal vein. Within the lesser omentum, लेसोमेंटम में 3 स्ट्रक्चर्स है ना. देयर आर 3 स्ट्रक्चर्स इन द लेसोमेंटम. हेपेटिक आर्टरी, portal vein and bile duct. These are the 3 structures. बराबर. Hepatic artery, portal vein and bile duct. And how are they arranged? They're not randomly arranged, students. They're not just randomly arranged. Out of these 3 structures, the hepatic artery, the portal vein and the bile duct, the most posterior, सबसे पीछे, the most posterior is portal vein. The most posterior is portal vein. Anterior and to the right of the portal vein is bile duct. Anterior and to the right of the portal vein is the bile duct. Anterior and to the left of the portal vein is hepatic artery. Anterior and to the left of the portal vein is hepatic artery. मतलब I'm telling you the relations in the lesser omentum, relations in the lesser omentum. बच्चों, in the lesser omentum, मतलब lesser omentum is extending from the liver to the stomach, right? Within the lesser omentum, you've got three structures, correct? Hepatic artery, portal vein, and bile duct. And there's a specific relation. They're just not randomly present. ऐसे randomly नहीं होते. Out of these three, सबसे पीछे कौन है? Who's the most posterior? Portal vein. To the right of the portal vein, bile duct. To the left of the portal vein, hepatic artery. Fine. And who's behind the portal vein? Behind the portal vein is IVC. And between the portal vein and the IVC is the epiploic foramen. Epiploic foramen. Look, if I have to make it like this, that's the portal vein. That's the portal vein. Behind the portal vein is the IVC. IVC. If that is right and this is left, to the right side, what is this? The bile duct. And to the left side is the hepatic artery. Understand? So that's the hepatic artery. That's the bile duct. That's a portal vein. That's the IVC. And what is this? Foramen. Epiploic foramen. ठीक है? Clear, students? Any doubts you have, you ask me. I still have got some time. I'll tell you something else here. This is clear? Faizan, clear है? So I've told you the complete peritoneum. I hope you all understood it, enjoyed the peritoneum. Okay, fine. Now students, what I'm asking you is, you just quickly tell me what is this? ये कौन है? ये कौन है? And ये कौन है? What are these three things that you're looking at? You can see that, no? Yes. Yes and yes. Now you answer. What are these three arrows? These are three ligaments, students. 3 ligaments होते हैं. If you can tell me what is that? The 3 ligaments going to the anterior abdominal wall. The 3 ligaments going to the anterior abdominal wall. What are those 3 ligaments? Anyone? What is this first one? I'll put number 1, number 2, number 3. The first one is the meaty N umbilical ligament. The meaty N umbilical ligament. The second one is the meaty L umbilical ligament, and the third one is the lateral umbilical ligament. Lateral umbilical ligament. Now, what are these ligaments? Quickly, I'll tell you this. So, meaty N umbilical ligament. Anyone? What is this meaty N umbilical ligament? Yeah, now fetal life में बच्चों, in fetal life there's a connection between the bladder and the umbilicus. In fetal life there's a connection, there's a communication between the bladder and the umbilicus. What do you call this? As urachus or allantois. After birth this connection is gone, and this is what we call as meaty N umbilical ligament. So this is the very good obliterated urachus or allantois. Urachus or allantois. ठीक है? अगर ये obliterate नहीं हुआ, suppose if this umbilical, suppose this urachus does not obliterate, the child will be passing urine through the umbilicus, and this is what we call as, anyone, what is this known as? A urinary fistula. Urinary fistula, or this is what is commonly called as weeping umbilicus. Weeping umbilicus. The child passes urine through the umbilicus. ये clear है? Very good, very good. Weeping umbilicus. Next is the meaty L umbilical ligament. Anyone? What is medial umbilical ligament? That's the obliterated umbilical artery. Obliterated umbilical artery. And the last is lateral umbilical ligament. That is a fold of peritoneum. It's not an actual ligament. ये actual ligament नहीं होता है. Lateral umbilical ligament is just a fold of peritoneum which covers inferior epigastric vessels. It's a fold of peritoneum which covers the inferior epigastric vessels. So I told you this also. Medial, lateral umbilical ligament. Clear, students? So what is median umbilical ligament? It is the obliterated urachus or allantois. Fetal life mein there's a connection between the bladder and the umbilicus. In fetal life, this is known as urachus or allantois. After birth, this connection gets obliterated and that is the median umbilical ligament. Okay. The second one is medial umbilical ligament, and what is that? That's the obliterated umbilical artery. And the third is the lateral umbilical ligament. What is that? It's just a fold of peritoneum. A fold of peritoneum which covers the inferior epigastric artery. Okay, that's about the topic. Any doubts you have, you can ask me. किसी को कुछ भी डाउट्स है तो बोलो. Yes, अर्पिता. Very good. Medner, Faizan. If you have any doubts, you ask me. Sadal, Priyanshu, Sumita. Clear? No, Sumita, you joined late, but you understood everything. Yes, bachcho, bolo. Anything else, if it is not clear, you can ask me. I still have time. Okay. You know what is Meckel's diverticulum? जैसे ये in fetal life the bladder is communicating with the umbilicus. वैसे crystal clear. Okay, जैसे ना fetal life में the bladder is communicating with the umbilicus, वैसे in fetal life the midgut communicates with the umbilicus. What is that known as? Answer this. Yes. What is that known as? I'll tell you. Yes, in fetal life, जैसे ना the bladder communicates with the umbilicus, वैसे in fetal life the midgut communicates with the umbilicus, and what is that known as? The white line duct. The midgut is going to communicate with the umbilicus. That's the white line duct or the vitreointestinal duct. Normally this entire duct obliterates off. ये obliterate हो जाता है. If the entire duct is going to persist, it is known as the fecal fistula. Fecal fistula. But most of the times the distal part of the duct is gone. The distal part goes off and the proximal part is going to persist. Okay, so the persistent proximal part of the white line duct is known as what? Meckel's diverticulum. Correct? The persistent proximal part of the white line duct is known as the Meckel's diverticulum. Yes. Yes, Arpita, what happens, you know, the lever से जो peritoneum आता है ना, less omentum, encloses the stomach and goes down as the great omentum. Now this great omentum again turns like this. ये जो great omentum होता है, look, that's the lever here. I'll just show you like this. That's the less omentum. That's the stomach. It encloses the stomach and goes down like this. So this is the first and the second layer of the great omentum. The great omentum turns and goes back. So the second layer becomes the third, and the first layer, the second becomes the third, and the first becomes the fourth layer. And now it encloses the transverse colon here. So that's how the peritoneum folds. बाद में this gap is gone and they fuse. ये fuse हो जाते बाद में. That's how it turns like this and goes up again. Only that you have to know. Nothing else. Nothing else is specific as such. Okay, so I hope everything is clear to you. Thank you. Thank you to all of you. Thank you for the patient listening. And next time again we come up with such lectures for you. Okay. Fine. Thank you. Thank you to all of you. Thank you. Yes, thank you Priyanshu, Mednir, Arpita.